Bismillahirrahmanirrahim. Dear students and learners, as we have already covered the part 1 from the lecture Anemia. This is the second part because the anemia is a large topic. So here we basically cover the remaining part, which is consisting of thalassemia and polycythemia, which is one of the type of anemia. So we will go for the second part. Here we will start with the in the previous first part I already explained you what is hemolytic anemia. Hemolytic anemia is basically in which the red blood cells are getting destructed because they become fragile. They are not of good quality. So lytic means slices. There is slices of the RBCs. So the number of RBCs will be decreased, or either they are become fragile, they are useless. So I now come to the hereditary spherocytosis. This is one of the type of hemolytic anemia. So in this condition, in the spherocytosis, it is a genetic disorder of the red blood cell membrane, clinically characterized by anemia. Jaundice means the body becomes yellow, and splenomegaly means there will be enlargement of spleen during hereditary spherocytosis. In the hereditary spherocytosis, the red blood cells have a spherical rather than biconcave disc shape of the normal red cell. As we know, the red blood cells is usually the biconcave disc shape, but in the case of this condition, hereditary spherocytosis, they become spherical in shape. These round red cells are osmotically fragile and less flexible than normal red blood cells, and tend to get trapped in the narrow blood vessels because they become spherical, and they are less flexible. They become trapped in the blood passages, and particularly in the spleen vessels, and there they break up, hemolyze, that is as I told you that there will be hemolytic, leading to hemolytic anemia. So this is one of the type. And then another type of hemolytic anemia in which there is breakdown of RBCs is the sickle cell anemia. This is again a genetic disorder, a genetic blood disease due to presence of abnormal form of hemoglobin. Here there is abnormal form of hemoglobin, namely hemoglobin S. Hemoglobin is is a molecule in the red blood cells that transport oxygen from lungs to the farthest parts of the body, that is supply the entire body. When this hemoglobin is exposed to low concentration of oxygen, it precipitates into the long crystals inside the red blood cells. This gives the RBC a sickle shape. So the sickle cell anemia is caused by an error in a gene that make the beta globin chain of the hemoglobin. What happened? There will be error in a gene, genes that make the beta globin chain of the hemoglobin. The resultant abnormal hemoglobin, that is sickle hemoglobin, deforms the red blood cell when they are under low oxygen concentration. As I told you that they become hemoglobin become precipitated. So the children who inherit two copies of sickle gene, one from each parent, have sickle cell anemia. Children who inherit the sickle cell gene from only one parent, they do not have the disease. In sickle cell anemia, the hemoglobin molecule tend to aggregate after loading oxygen. They form long, rod-like structure that force the red cell to assume a sickle shape. Unlike normal red cells, which are usually smooth and deformable, the sickle cell cannot squeeze through the small blood vessels. The sickle cell block little vessels, depriving the organ of the blood and the oxygen. This leads to periodic episode of pain and damages of the vital organs, because there will be lack of oxygen, as well as blood also carry nutrients, so there will be deprivation of the both the things. So we will feel pain and damage to the vital organ. Normal red blood cell last about 120 days in the bloodstream, but in the sickle cell die after only about 10 to 20 days. So we can compare that in a normal person, cell can survive for 120 days, but in a person who is suffering from sickle cell disease, their RBCs can survive only 10 to 20 days because it cannot be replaced fast enough. The blood is chronically short of red blood cell causing anemia, and the condition is known as sickle cell anemia. Now come to the another type of hemolytic anemia, which is very common, and this thalassemia. Thalassemia are a group of inherited microcytic hemolytic anemias. Microcytic hemolytic anemias characterized by defective hemoglobin synthesis. So here we observe that there is defective hemoglobin synthesis. Thalassemia is an inherited autosomal recessive blood disease. In thalassemia, the genetic defect, which could be either mutation or deletion, there can be mutation or deletion that results in reduced rate of synthesis or no synthesis of one of the globin chain that make up hemoglobin. So this can cause the formation of abnormal hemoglobin molecule. Therefore, it causes the anemia, the characteristic presenting symptom of the thalassemia. So, what we learned here, we learned that in the case of thalassemia, this is not just one problem. There is a group of inherited microcytic problem that can lead to hemolytic anemia, and basically it is due to the defect in the hemoglobin synthesis. Thalassemia is a quantitative problem of too few globin synthesized, whereas sickle cell anemia, a hemoglobinopathy, is a qualitative problem of the synthesis of an incorrectly functioning globin. So you must differentiate that both are associated with the problem in the hemoglobin, but in the case of thalassemia, the quantity of the synthesis is decreased because of the abnormal chains. However, in the sickle cell anemia, there is quality of the problem. There is precipitation in the hemoglobin. That is, the quality will be disturbed. So thalassemia usually result in under production of the normal globin protein, often through the mutation in the regulatory genes. Once again, I remind you that the hemoglobin is required for the carrying of the oxygen. So the two conditions may overlap. However, since some conditions which cause abnormalities in the globin protein, hemoglobinopathy, also affect their production, thalassemia. Thus, some thalassemias are hemoglobinopathies, but most are not. Either or both of the condition may cause anemia. Thalassemia, normal hemoglobin also called as hemoglobin A. Okay, normal hemoglobin also called as hemoglobin A has 4 protein chains, 2 alpha globin and 2 beta globin. The two major types of thalassemia, alpha and beta, are named after defects in these protein chains. Now come to the alpha thalassemia. First of all, we will have a look on this. In case of alpha thalassemia, what will happen? 4 genes, 2 from each parent, are needed to make enough alpha globin protein chains. Alpha thalassemia trait occurs if one or two of the 4 genes are missing. If more than 2 genes are missing, moderate to severe anemia occur. The most severe form of alpha thalassemia is called the alpha thalassemia major or hydrops fatalis. Babies who have this disorder usually die before or shortly after the birth. So the alpha thalassemia is very dangerous if more than 2 genes are missing. 2 genes, one from come to the beta thalassemia. 2 genes are needed, as we know, to make the enough beta globin chain. One from each parent. Beta thalassemia occur if one or both genes are altered. The severity of the beta thalassemia depend on severity of beta thalassemia depend upon how much one or both genes are affected. If both genes are affected, the result is moderate to severe anemia. The severe form of beta thalassemia is known as thalassemia major or Cooley's anemia. Now I will return you to the back slide. Here we see alpha thalassemia required 4 genes to make alpha globin protein chains, and if this condition become severe, it is known as alpha thalassemia major or hydrops fetalis. So don't be confused with this. Alpha thalassemia is associated with alpha 4 genes, and alpha thalassemia major or hydrops fetalis, and beta thalassemia is associated with 2 genes, and the severe condition is known as thalassemia major or Cooley's anemia. Now come to the another condition is which is associated with red blood cells, but here the number of RBCs will be increased, and the condition is polycythemia. Polycythemia is a condition. Polycythemia is a condition that results in an increased level of circulating red blood cells in the bloodstream. People with polycythemia have an increased hematocrit, hemoglobin, or red blood cell count above the normal limit. Polycythemia is normally reported in terms of increased hematocrit or hemoglobin. Means either the red blood cell count will be increased or the concentration of hemoglobin will be increased. So first of all, if we see the hematocrit, polycythemia is considered when hematocrit is greater than 48% in the woman and 52% in men. So normally the hematocrit which is present in the normal person is 38%. However, in a woman and 48% in male. However, in case of polycythemia, the concentration will be increased to 48% in women and 52% in men. Now come to the hemoglobin. Polycythemia is considered when hemoglobin level is greater than 16.5 gram per deciliter in women or hemoglobin level greater than 18.5 gram per deciliter in men. Normally its value is between 12 to 15 gram per deciliter in normal person. However, its values increase too much in the case of polycythemia. Polycythemia can be divided into two categories, primary and secondary. Primary polycythemia. In primary polycythemia, the increase in red blood cell. In primary polycythemia, the increase in the red blood cell is due to inherent problems in the process of red blood cell production. And the secondary polycythemia is a condition generally occurs as a response to other factors or underlying conditions that promote red blood cell conditions. Means primary polycythemia is basically inherited from the parents. However, in the case of secondary polycythemia, there may be several other environmental factors that can cause destructive or low quality red blood cells or increased number of red blood cells which are of low quality. Primary polycythemia rubra, uh, polycythemia vera, polycythemia rubra vera or erythemia occurs when excess red blood cells are produced as a result of an abnormality of the bone marrow. Often the excess white blood cells and platelets are also produced. Means there is excessive production of cells from the bone marrow in the case of polycythemia vera, and this is the type of primary polycythemia. Signs of physical examination include an abnormal enlargement in the spleen and liver. In some cases, affected individual may have associated conditions including high blood pressure or the formation of blood clots. And in case of secondary polycythemia, it is caused by either natural or artificial increase in the production of erythropoietin, lead to an increase in the RBC production. In this condition, there are 6 to 9 million erythrocytes per cubic millimeter of the blood. This condition subsides with treatment. Secondary polycythemia, in which production of erythropoietin, remember here we are talking about erythropoietin. So in the production of erythropoietin increases appropriately is called physiological polycythemia. Secondary polycythemia, in which the production of erythropoietin increase appropriately, is called physiological polycythemia. Physiological polycythemia occur due to adaptation while living at the high altitude. Sometimes when we move from, as I told you that secondary polycythemia can be because of the also because of the environmental factors and other factors that can lead to polycythemia, such as the increase erythropoietin because of any reason, and it can be increased because of the movement towards the high altitude, so there will be adaptation. Sometimes hypoxia linked diseases such as cyanotic heart disease, where blood oxygen levels are reduced significantly, and because of a low oxygen level it can serve as a stimulus and cause physiological polycythemia. Hypoxic lung diseases and chronic obstructive sleep apnea, these conditions can lead to hypoxia, and hypoxia can lead to signaling for the polycythemia, that is increased number of red blood cell production. Secondary polycythemia can also be because of the genetic cause, like hereditary causes in patients with special form of hemoglobin known as hemoglobin Chesapeake has a great inherent affinity for oxygen than normal adult hemoglobin. So there is a condition hemoglobin Chesapeake which high affinity of oxygen than normal adult. Of course, when there is high affinity for oxygen, of course it will reduce the oxygen delivery to the kidney, causing increased erythropoietin production and resultant in the polycythemia. Physiological effects of anemia. There are vast number of effects that can be occur when there is anemia in the body. Decrease in the viscosity of the blood. In the severe anemia, the blood viscosity may fall to as low as 1.5 times as that of the water, rather than normal value of about 3. So viscosity of the blood is increased because of severe anemia. Hypoxia occur, causing the peripheral tissue blood vessels to dilate, allow them further increase the return of blood to the heart, causing increased cardiac output. Increased cardiac output is a major factor of the effect of anemia. Muscle fatigue. During exercise, heart is not capable of pumping much greater quantity of blood, so muscle can lead to the fatigue. In cardiac arrest during exercise, with great tissue demand during exercise, we need our muscle required more and more oxygen. So extreme tissue hypoxia result and cause acute failure of the heart occur. So that can lead to cardiac arrest. Nervous system also affected by the anemia. The demyelination of the nerve fibers in the people with vitamin B12 deficiency occur. As a result, many people with pernicious anemia have loss of peripheral sensation and in severe cases may become paralyzed. So for more upcoming content, subscribe my channel, and I am thankful for your concentration. Thank you so much.